You coming back.
Thank you.
We already have a caller for you.
Great.
We have Jackie from Charlestown, and I think, Jackie, are you with us?
I am.
And I think you have a lumbar spinal stenosis. I know that's a very painful problem to have, and you are experiencing some bowel pressure?
Yes, I am.
And you want to know if these could be connected?
Yes.
Okay.
It definitely can. You know, when you have any kind of pressure on your nerves, it does everything in your body pretty much. If you have any kind of, they say up to a pressure of the weight of a dime, if you're putting pressure on that nerve, it's going to make the bowels function as good as it should be. And stenosis is pretty much narrow the hole where the nerve comes out, and you put pressure on it, it could definitely cause a lot of problems in that area.
So is this something that you can treat through chiropractic services?
It's not 100%, you know, like nothing is. It's definitely all we try out. We usually have a pretty good success rate with it.
Okay, Jackie, good luck with this. I know it's a tough one to treat, isn't it?
It definitely is.
Yeah,
probably one of the hardest.
A lot of people will eventually move on to surgery that have this.
It could.
All right, but if you can prevent that, I know a lot of people would like to say,
most definitely.
Fix me up. All right, you want to talk a little bit about headaches today, right? And some ways to relieve headache pain?
And we have a 6-step solution. Migraine headaches are becoming an epidemic now, especially in women. We have a 6-step solution. Like I said, we work with women as far as their diet. I know a lot of diets, the food you eat is a trigger to the headache. Sometimes people don't realize that. So when we get somebody on a program, we have them take a diary of what they're eating. We teach them how to breathe properly, how to exercise. And the 6th step that we usually go over is actually fixing the top bone in your neck. It's the C1, it's called the atlas bone. If that gets tilted and rotated, it actually causes atlas neurovascular syndrome.
Now, how do you know if this needs to be fixed?
We take precise x-rays. There's 5 views we take. And it's very precise x-ray. You can see actually to the millimeter how the top bone is actually misaligned. I actually have a model here. And what happens is if this bone gets tilted, this is a C1 and C2, the top 2 bones in your vertebrae. If they get tilted and rotated, it causes a lot of pressure on the brainstem, which comes to the middle. And you got vertebral arteries that makes 4 90-degree angles around those holes here as well. And it causes pressure on the blood vessels as well.
Now, is this more common in women or men? Or
more common in women, but we're seeing a lot of men having it. But it's almost like an epidemic in women. You know, a lot of women have menstrual periods, and they say, well, that's why I'm getting a headache. That's a trigger. You know, some women have a menstrual period and never have a headache. You know, you hear people say, when I eat chocolate, I get migraines. It's debilitating headaches. But that's not the case in everybody. So when you get everything lined up properly, you see it functions a little better, and the triggers don't happen as often as some people. That's the whole purpose of having a diary.
All right. All right, some good suggestions there. Anthony Sears, thanks for being with us with Austin Chiropractic, and that's in Linden, right?
Yes.
All right, thanks for coming back.
Road.
All right. And we'll be right back.